So my name's Sasha and I'm currently undertaking my pre-reg year within Ayrshire Arran at Crosshouse Hospital.
Hi there, my name's Rebecca. I'm the current pre-reg at Ayr Hospital.
Hi, I'm Caitlin and I'm currently completing my pre-registration year at Crosshouse Hospital within Ayrshire Arran.
Yes, 100%. I've really enjoyed my training year at NHS Ayrshire Arran at Ayr Hospital.
I really recommend coming to Ayrshire Arran if you're thinking of doing your pre-reg in Scotland.
I would recommend completing my pre-registration training within Ayrshire Arran because it's a smaller health board, but within that you still get lots of opportunities and responsibility to learn about hospital pharmacy.
It's a really great health board to work in. It's one of maybe the smaller ones, but it doesn't fall short on experience and showing you all the different kind of areas where you can go into as a pharmacist. I think it's really shown me all the different roles that a pharmacist can have within the hospital sector and out with that as well, because you do spend some time in the community sector as well. So I think it gives you a really good experience of the overall role of a pharmacist.
It's such a welcoming team that have been so supportive with me and have allowed me to learn so much and give me so many great opportunities that I never thought I would with my pre-reg year. I think the great thing about it is you spend some time doing in the blocks, that you'll spend a while in dispensary and then go to a different area and rotate back round, but I think you definitely get the chance to get new experiences at every place and notice yourself developing and doing more things, and you can see how far you come when you can revisit places that you've been before.
So our timetable was quite varied and we rotate through different specialties. So we spent time in medical wards, surgical wards, done a bit of time in medicines information, spent a week in the mental health hospital, and then went to other specialties such as oncology, aseptic, a wee bit of time in paediatrics and neonatal as well.
My timetable was really varied throughout the year. I spent a lot of time in the dispensary learning different roles within that as well. I spent some time in the aseptic dispensary. We also spent some time in the medicines information department and on various different wards such as the clinical wards, surgical wards, paediatrics, renal, oncology, and the list goes on really. It's really good. There's a wide variety of different expertise that you get to experience.
Yes, definitely. I've really felt very well supported. I think that's such an important part of the pre-reg year as well, because it is such a big change from going to university to starting work. But the team at Ayr Hospital and across Ayrshire Arran have been so supportive.
I felt really supported throughout my training year from the beginning and right from that first day, because it's a scary day coming into a brand new thing when you've just left uni. So throughout the year it's been great. Not only my tutor but everyone else has been really good. There's not anyone that I wouldn't be able to ask a question to within the health board, and you always know who to contact if you are kind of struggling personally or within work. If you've got a query about something as well, there's always someone to turn to.
Throughout the year I've felt really well supported in many ways. I've got a tutor, so we have weekly meetings with our tutor, and they're there for any problems that you've got, but also like within the whole pharmacy team, anyone's there to help with any questions or anything that you have.
This is a hard one to choose because there's such a variety of areas you get to go to. I think I really enjoy going to the oncology area. This is something I was expecting because I've always found oncology interesting to university. I did my dissertation on oncology and I was really looking forward to my time in oncology at Ayr Hospital, so that was definitely great.
My favourite area was probably down in CAU, which is like the combined assessment unit. I just found there's a smaller pharmacy team down there and you're really embedded within the multidisciplinary team as well, so I really enjoyed it down there.
My favourite area that I worked in this year was probably in the renal pharmacy, the renal area, because I really found that to be quite different to all the other areas, and I saw the role of a pharmacist prescriber really prominent in that area. During the ward rounds and stuff, the pharmacist kind of prescribes most of the medication, which I found was really useful, and I could really see how important a pharmacist is to a patient's treatment in that area.
So throughout the year I've worked with lots of different pharmacists, and at different stages you work more closely with pharmacists, or you might work more like on your own but still having the support of other pharmacists. And through this you've worked in the multidisciplinary team as well, so talking to other doctors, nurses and other members like that.
So throughout the year you work with lots of different pharmacists, there's not just one person. So it's quite nice to just see how different people work, and I think you get a lot from each person. You kind of then build up your own way of working by taking each of their techniques and adapting it to yourself. So it's good to not just be left on your own and feel like you've got nowhere to turn to.
One of the great things about the hospital pharmacy is getting to work with all sorts of different pharmacists who can help you in all sorts of different ways. You get to spend a lot of time with the pharmacists that specialise, so that's a great way to kind of see where your career could go as a pharmacist and see how you can start off as a pre-reg in the hospital and then kind of specialise, and they've shown you so many great things.
However, towards the end of the year they do give you that little bit of responsibility on your own, but you always know that there are pharmacists that you can turn to for help if you need to.
So far I've really enjoyed my year, and it's been a really quick year. I can't believe it's coming to an end. But just like through tracking my progress through TURAS, it's like the competencies that we've got to complete through our pre-reg, I've seen like a massive difference in myself from when I started to now.
So looking back at the year is to reflect on a really busy year. However, it's so full of different experiences and opportunities to learn. So I think it's been one of the best years since starting my pharmacy career, since uni.
I've got so many personal reflections. Looking back in my reflection logs, I think I've got almost 100 different things that I've reflected on.
And things like my confidence and everything's increased as well.
And I think it's a great thing to do your pre-reg because you just grow so much as a person, and your professional skills just grow as well.
Definitely been development of my professional and kind of clinical skills during my pre-reg year. We definitely learn a lot clinically from being in the ward and seeing how the medicines are used and the kind of treatment and the plans and all those sorts of things.
Throughout the year I would say that my professional and personal skills have developed, especially like communication and working within a team. Throughout the year I've had the chance to communicate with a wide variety of different people through working in like wards or within the pharmacy department, and that's essential with working in a team as well.
My professional and personal skills have really grown since I've started my pre-reg year. When I look back to when I first started, I was really not confident. I felt like I didn't know enough from uni to go out and do this job on my own. But now I've grown so much and I've gained so much confidence, and I can go out to the ward myself and answer questions and view patients and not feel worried about I'm going to make a mistake or I've got nowhere to turn to. So it's been a great thing for me, confidence wise.
If I might have been on the ward initially at the beginning, I might have encountered a problem and kind of not known where to go or not knowing the answer, but now with the kind of clinical and professional development I can see a problem and maybe not always know the answer, but know where to look and what kind of direction to take. So there's definitely been a lot of learning and developing this year. Definitely had a great time doing my project. That was really interesting. Mine was about kind of patient shadowing and how the transformational change work is going to be in Ayrshire Arran.
So within Ayrshire Arran there's a really good education and training department, and we had the opportunity to help out with training the new foundation doctors and also pharmacy students and medical students as well. So that was really good for me.
Through case studies, this was something I've never had like the responsibility to do, so I was quite glad to have that opportunity, because normally I'm used to like being taught things. So I thought by taking the students, it like taught me how much I actually knew without realising it.
I've had the opportunity to kind of look after a room in the ward or coming up to doing a whole kind of ward myself. This has been great. It's really shown me how I can put my learning to practice and apply what I've been learning all throughout university and my career year to kind of do things independently and seeing how I can make a positive difference as a pharmacist in the ward.
Which is it? What would you say?
Why don't, even if you just get one of us to
Yeah.
say it there, and even if you just say something like, if you're considering a pre-registration year in Scotland, we highly recommend
Yeah.
coming to Ayrshire and Arran
Okay.
or
Do you want
something.
to volunteer?
And
That's
then
it.
you volunteer.
Yeah.
I highly recommend working in Ayrshire and Arran if you're considering doing your pre-reg in Scotland.